name is Matthew Tyler, and I want to thank you for joining me as I discuss my practicum experience at Ascension Via Christi St. Francis Hospital. St. Francis Hospital is part of the Ascension Via Christi Kansas network that has been serving the community for over 120 years. They are the largest provider of healthcare services in Kansas, are a nonprofit faith-based organization with over 400 providers at 75 sites of care. St. Francis Hospital is known as the flagship hospital for Ascension Via Christi. They offer complex services throughout the continuum of care, from hospital-based outpatient departments to highly complex surgical, diagnostic, and intensive care. They've achieved numerous certifications and are accredited by the Joint Commission. They are a regional burn center, a comprehensive stroke center, chest pain accredited, level 1 trauma center, certified in bariatric surgery, FACT, CAR-T, Commission on Cancer, and accredited through the Joint Commission for Lab. My role as a practicum student, with my preceptor Michelle Henderson, who is a highly experienced chief nursing officer, provided me with education and exposure to executive nursing leadership. One example was I was able to provide a gap analysis for nurse staffing. This showed that we needed to increase the FTE complement, which then further increased patient volumes, improved throughput through the hospital, decreased ED boarding times, and improved overall net revenue. This shows that strategic planning, its effect on hospital operations, that further affects financial management and resource utilization. My applied learning project was nurse leader development through a transition to practice program. The transition to practice program is a 12-month self-paced program. It starts with leader standard work, daily tasks, weekly tasks, and monthly tasks, that then moves into foundational leadership skills, enhancing upon those skills, and then further accelerating those through targeted development and competencies. The whys behind this: it promotes team engagement, improves recruitment and retention, improves overall excellence in patient care delivery, and enhances leader development to improve experience and impact. To show the program's success, it must be measured. This is a dedicated investment of time. Completion of milestones will be measured through various points throughout the journey, and various metrics will be captured in comparison to those who have completed the program against the baseline. Some of these metrics include retention, turnover, and associate experience. If you look over to the right, it shows that this process is cyclical, very similar to a PDSA cycle. Here's a high-level overview of additional projects or exposure or collaboration as they relate to the domains within the MHA program. I was able to collaborate with various multidisciplinary teams throughout the continuum of care. This included providers, allied health, had a close partnership with the CFO and labor engineer to ensure that we had the right FTE complements and that we were within our productivity metrics. Had in-depth involvement in regulatory compliance, survey readiness, including regulatory surveys. We had consistent action planning around consumer experience, CMS star ratings, and collaboration with providers, allied health, and labor relations. Town halls, recognition events, ethics integration, and feedback mechanisms. I feel that practicum has prepared me to use the academic knowledge that I've gained through the MHA program in an executive leadership role in healthcare. I was able to see alignment of clinical operations to key strategic planning, improve overall knowledge of the complexity of healthcare and systems thinking. I was able to apply knowledge for optimization of staffing and productivity management. I was able to improve my overall understanding of organizational culture driven by the mission and values of the organization, and improve capabilities and experience through staff engagement, feedback mechanisms, and multidisciplinary collaboration. Thank you.